Are you wondering, is there anything I can do to increase my chances of a good outcome for prostate cancer surgery? Another question I get from many of my patients is, what supplements can I take to prevent prostate cancer? Well, I have good news for you. Today we have expert Dr. Jill Hamilton Reeves joining us on the podcast who can address these questions for you. So stick around. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Joining us today on the Prostate Health Podcast is Dr. Jill Hamilton Reeves. She is a registered and licensed dietitian with doctoral training in translational and clinical nutrition science. She is Associate Professor of the Department of Dietetics and Nutrition at the University of Kansas Medical Center and is Director of the EDGE Lab for the Department of Urology, which stands for Exercise, Diet, Genitourinary, and Endocrinology Research Laboratory. She works with urologists and medical oncologists to foster the discovery of better diet and exercise approaches to benefit patients with cancer, including prostate cancer. Dr. Hamilton Reeves, welcome to the Prostate Health Podcast.
Hey, thanks. Thanks for having me.
So Dr. Hamilton Reeves, so when we talk or think about cancer in general, why is diet and nutrition so important during cancer treatment?
Well, it's really important to keep ourselves strong and resilient as we're facing treatments. I also think for your listeners that may be at higher risk of developing cancer, it might be helpful just to get some framework as far as what does the role of diet and exercise and lifestyle play in the incidence of cancer. A lot of people think that cancer is genetic, solely genetic, and kind of fatalistic of, I'm going to get this anyway. And so I just think it's really important to share that between 40 to 50% of cancers can be preventable. You know, that's including all lifestyle things like not smoking, using sunscreen, getting vaccinated, as well as keeping a healthy body weight, healthy diet, and movement. And then if you kind of just hone in on the things that are related to nutrition, that accounts for about 33%. And so I think just keeping that in mind as far as the power of the choices that we have multiple times a day, every day. And that's why we do the work we do.
Well, with the obesity epidemic, it is truly a public health crisis. I'm sure you've seen the most recent adjustments and calculations. Now in 2030, it's estimated that 50% of Americans will be classified as obese or body mass index or BMI of 30 or higher. Now tell us, why is this concerning for those of us that treat prostate cancer?
Yeah, so being overweight or obese is associated with increased risk of advanced prostate cancer. So those are the cancers that are a little more aggressive. Not every man is really at risk for advanced prostate cancer, but I think just, again, knowing the role that obesity and overweight plays in that. For people that have already been diagnosed with cancer, there's also data showing that people that go into a prostatectomy, so having localized prostate cancer, they are more likely to have recurrence and die if they're overweight and obese at the time of that surgery. And so that's one of the things that our lab is really looking at is, why is that? And are there ways to disrupt that link? When is the best time to do that for making behavior change?
Now, we often hear of the aha moment, that moment of sudden inspiration, insight, or comprehension. Was there any of these aha moments in your research?
Yeah. So when we were preparing for today's talk, you had mentioned an aha moment that is on the internet of me talking about a different project in bladder cancer, where I think I used an analogy of preparing for a bladder removal, a cystectomy, as like a marathon and thinking about before the event and after the event. And honestly, a lot of our projects, because we work with many surgeons, are in that framework of thinking about facing a big event and how can we help patients be as resilient and strong as possible. So a little differently than the bladder cancer project, in working with men that are having their prostate removed, there's a lot of things that are out of the control of the patient. And things like movement, good sleep, a healthy diet, those are actually within the locus of control of a patient. And surrounding a person in their journey with support and help, accountability has been really an aha moment for me. Everyone has a slightly different need for what it is that's going to help them really build up the resilience. And yet I've realized the more that we've done these projects that when we take time to listen to our participants, our guys, the answer lies within. They know what they need. And oftentimes, because we're working with men that are overweight or obese in that particular project, oftentimes they also know the obstacle that is in their own way. Many times they just need help kind of finding their navigation around. There are definitely people that have a knowledge gap, and that's easy. Are people that have a knowledge gap but are very ritualistic and routine, wow, we give them the information and they just like run with it. But society as a whole tends to have a damaged relationship with food. And I think that has really been helpful. And an aha moment is, okay, I probably don't have the magic bullet for you, but you have it. Let's talk about it and we'll help you figure out how to pull that trigger and really take you to the next level of health, even at a time that you're facing one of your biggest health diagnoses and crises of your life.
Well, thank you for sharing that.
Yeah.
And now, and with that, you're really a leader in this area, leading efforts nationally. Can you share with our listeners, regarding some of your research and helping answer the question, what can men do to improve their prostate cancer outcomes for surgery?
Yeah, so I've alluded to a trial that we're doing. We call it the Warrior Trial. And as you can tell from the acronym for our lab, that I apparently really like acronyms. It's kind of a fun thing in research. So Warrior stands for weight management aimed to reduce risk and improve outcomes from radical prostatectomy. And it's a trial that's funded by the American Cancer Society. And really what we're looking at in that trial is whether or not we can disrupt that link between obesity and advanced prostate cancer. And so what we do is we work with men when they find out that they're going to have their prostate removed surgically, and we help them lose between 5 to 10% of their body weight, sometimes a little bit more, before their surgery. And then after surgery, we work with them to help maintain that weight loss for hopefully for their life. But we work closely with them for 6 months before they finish our program. And we're looking at lots of different things. So one of the things your listeners may or may not know about fighting cancer is that cancer is super smart. And as scientists, we think of cancer having a playbook. There's like about 13 different hallmarks of plays that cancer will make to like keep alive and grow. And it's interesting that obesity happens to facilitate many of those plays. And so what we're looking at are the mechanisms, the biology to see, okay, out of all of those plays that cancer uses, if we intentionally lose weight through being healthier, how many of those can we actually detangle, disrupt that link? We've had some preliminary work that suggests that many of them are disruptible. Things like controlling blood sugar, better heart health, better hormone levels, and quality of life. So that's not necessarily a mechanism for the cancer itself, but the guys feel better. And yet there are some where we're still exploring. So I think we're going to be talking a little bit more about that later. So that's our work. Our last few participants are wrapping up this summer. So summer of 2020. And this next year will be all in the lab, running samples and looking at mechanisms and working with our super smart colleagues to help make sense of the data as it unfolds.
Well, that's exciting work, and really look forward to seeing some of the results. And it sounds like like you said, preliminary. You're already seeing some good data coming out of that study. That's awesome. And and men are really wanting to learn more about nutrition in relation to their prostate. In fact, we have a very active Facebook group for the Prostate Health Podcast that listeners can join, and this is already coming up in discussion there. Men just want to know more about what they can do to really improve their prostate health.
Yeah, I think it's been frustrating because a lot of the trials that we consider nutrition trials in prostate cancer have been mixed or disappointing results. And sometimes our guys come to us feeling a little bit defeated about that. And so really kind of helping them see what, again, the locus of control for their own health, where the data are currently, and, what we've learned from all of those trials that really didn't show what we were hoping.
Now, how about for men on hormonal therapy or that androgen deprivation therapy for prostate cancer to lower their testosterone levels for this advanced prostate cancer? What evidence is out there so far in terms of, nutrition, exercise, and what is currently being looked at?
Yeah, that's a great question. So we're helping with another study in that space. So I'm not the lead on that. Dr. Sally Maliski, the dean of our School of Nursing at KU, is the PI on that trial. But in that study, we are helping the guys preserve muscle mass, hopefully, prevent extra fat deposition that typically happens with androgen deprivation therapy, and also helping with heart health, which of course it takes a hit with using those medications, again, because of the hormonal effects and the role that hormones play in heart health and bone health. And as far as where the data are at right now, there's quite a few trials looking at exercise and different modalities of exercise to help with preserving muscle and keeping the fat deposition at bay. And we used one of them in this study. We worked with a physical therapist and did like a home exercise type of program. But there's some really cool trials that are wrapping up. They don't have their data published yet, but there's some that have tried endurance training. And then there are others that have taken more of the approach of high intensity training. Some have used resistance training. I think the take home message is that movement is likely going to be part of the puzzle here. And also learning how to fuel oneself and keep at energy balance, because our hormones affect our appetite so much. And so it is a period of time where relearning how to feed oneself to keep from, fat really layering on is more challenging. And I think the studies that have had people like our team and nutritionists helping them have been able to be that kind of support that people need at that time where your body might betray you a bit in how much you actually need to eat during that time, because you're going to feel hungrier even though you may not need that extra energy. Does that make sense?
Yeah. I really enjoyed our pre-interview chat, and I was going to see if you could tell us about any of the other projects you're looking at or to look forward to for men with prostate cancer. I know you talked to me about one that you're working with, urologists like myself at your institution at the time of surgery, and I was going to see if you could tell our listeners a little bit about that upcoming study.
Yeah, so we have a few different things that we're looking at that I think are exciting. So I'll start with the nerdiest one. So this idea of obesity worsening prostate cancer outcomes, we think that there's something about the periprostatic fat, so the fat that surrounds the prostate, that's sending signals to the cancer within the prostate saying, come on out, let's spread, let's make recurrence more possible. And so we're getting the fat from the surgical samples and looking at those mechanisms, like I said, this next year to see if we can figure out if that is playing a role. And then we can kind of go from there for how to tackle that issue. A couple of other things that we've been really interested in is listening to the guys talk about their eating behaviors. There's a lot of our participants that don't eat in the morning, and they tend to eat a lot at night, or they eat one meal a day, and helping, asking those guys, well, how's that working for you? And usually if they come to us, the story is that hasn't been working so well for them. And they're kind of facing that for the first time. So that's sometimes a jagged pill to swallow. But there's more and more data about, they call it chrononutrition, about looking at the timing of meals with our rhythms within the day and front loading the day a little bit more with your energy to fuel what you're doing throughout the day. And again, if you think of an athletic example, a lot of athletes underfuel and then they underperform. So if you underfuel your day when you're wanting to perform well, ask yourself a little bit about that. I think that can be really helpful. So that's something we're looking at. Similarly, intermittent fasting has been a very hot topic. And so we're looking at some concepts and ways to do that, because again, we see a pattern where people want to eat with less restriction because of wanting not to deprive themselves. And that's super important psychologically. So coming up with plans that facilitate that, but still create a negative energy balance so that people can lose weight. And then lastly, issues of race has been a really hot topic, really current right now, and really important when we think about African-American men having the most aggressive prostate cancer, the highest mortality, and why is that? And so we've been working with neighborhoods here in Kansas City to really look at the social determinants of health and what some of those things are related to greater inflammation and immune responses that play a role in the severity of cancer. And we have some data that we're working on writing up where we actually see those biological differences that are likely modulated by the environment more than race. And yet race is a related factor. So yeah, that's what's coming down the pipe. I'm so glad you asked. That might have been a longer answer than you wanted.
No, well, I think it's exciting. I think your lab is doing amazing work in the field. Thank you. I commend you for that. So
thank you.
Some of the responses that are common that I hear, I've tried everything and just can't seem to drop any weight. What else can I do? Or, I've been overweight for years. Can I really lose weight? This can be daunting for many. And now where would you recommend that someone just even start in achieving weight loss?
Yeah, I think when someone gets to that point of frustration, and it's really important to get outside ourselves and get some help. And I'm a dietitian. I don't work clinically taking on patients one-on-one anymore, but people in my field do. And dietitians can be super helpful for helping with plans and addressing those. I do think it takes some time to find the right fit. And just like in all professions, there are some that are a little bit more knowledge-based, and they really focus on helping you bridge the knowledge of how to do this. And then there are some that are a little more behavior-based. And then there are the gems, the pearls within the field that know both really, really well. Those are the ones I would, maybe ask some questions, ask around, ask who has had good success and what that looked like. And again, just having somebody outside of yourself to help you look more objectively within as to what the real barriers are.
Well, thank you for that.
Yeah.
Well, this has really been helpful so far. Awesome information, and so for our listeners, if you've enjoyed our interview today so far, we're actually going to be recording some bonus video content today with Dr. Hamilton Reeves for the upcoming Prostate Health Academy, where we're really going to be diving into just how one can successfully accomplish some of these goals to improve their prostate outcomes. And, another question I get from my patients is, what supplement can I take to prevent prostate cancer? So we'll definitely be addressing that one as well in the after hour segment. So don't want to miss it. Just to get on the wait, we actually have a wait list now. So if you're interested in joining along with seeing some of the other behind the scenes interviews with our podcast guests, just go to prostatehealthacademy.com, scroll down and just sign up for the wait list. We'll be doing something special for those on the wait list when we launch. So don't miss out. So Dr. Hamilton Reeves, any final thoughts for our listeners?
Yeah, that's a good question. So I am a dietitian and I run a nutrition lab. I think one of the things, though, that I've noticed with our participants is that the easiest first step for many of them has been just increasing movement. And so, we talked about the relationship between obesity and cancer, and just zooming out because many of your listeners might be touched by other types of cancers or their loved ones. Obesity is related to 12 different types of cancers and increasing risk. What's interesting is exercise, intentional exercise, reduces the risk of all of those 12 cancers plus the blood cancers. So when we think about the cancers that are most affected by obesity, it's usually anything in the GI tract and in the hormonal ones, so breast and prostate. Yeah, and then exercise affects the blood cancer. So not even exercising necessarily to the point of great discomfort. Sometimes we have some extreme personalities that come to us, but thinking of movement throughout the day. And then, yes, if you can get between 75 minutes and 150 minutes of breathing deeply and sweating, it's amazing what that can do for your health psychologically, and then also things that you don't realize that are happening in your biology that improve health.
Well, thank you again for joining us today on the Prostate Health Podcast, for helping take the lead in this groundbreaking research, really looking at the importance of nutrition and its relationship to outcomes for men with prostate cancer. So you've really provided our listeners today with some valuable information. Thank you again.
You're welcome. Thanks for having me.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/prostate health podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.